This has been the case for many. Your COVID-19 symptoms never quite go away. The condition is called long COVID.
And now new research is providing some clues into who may be most at risk of getting long COVID. News 9's Robin Marsh has the details in today's Medical Minute.
From music lessons to shooting hoops, busy mother of two Jane Story always has to stay on top of her game. But 3 months after she was cleared for COVID, lingering symptoms, long COVID, threw her a curveball.
I was having a hard time breathing. I felt like my lungs were burning. And I told my husband, I was like, I think I have COVID again.
Story was experiencing long COVID, a condition where she had prolonged symptoms from her recent COVID infection.
We're seeing long COVID symptoms in about 10 to 30% of patients who've had COVID infections.
Initially, it was believed that people with severe COVID infections were the ones most likely to get long COVID. But those with mild infections are getting long COVID as well. Researchers from Seattle have found that the presence of certain autoantibodies, antibodies that mistakenly attack the body in the autoimmune disease, can put you at risk. The autoantibodies were found in 60% of patients with long COVID. Other risk factors, doctors say, people who have type 2 diabetes and a reactivated Epstein-Barr virus. And some doctors say even your gender may be a risk factor.
We think that there is a slight predominance for women over men.
So knowing these risk factors can narrow down treatment for people suffering with long COVID, like Story. She's currently getting therapy at a COVID clinic at Vanderbilt University. One other note, a Hong Kong study found that the bacteria in your gut might also play a factor in whether you develop long COVID. Be sure to talk with your doctor. For today's Medical Minute, I'm Robin Marsh.